Hi, Dr. Nagula. Welcome to Miracles Happen.
Hi, Maria. Thanks for having me.
Sure. I am really happy to invite you to chat with me today. We were talking before I hit record that you're the first person that I'm interviewing that is not at all in the fertility field.
And I'm so honored.
Yeah, we're not talking about fertility stuff, right? No, we're not. But everything that we talk about affects fertility just like it does all health related issues. So just for listeners and watchers of this podcast, I was outreached by Dr. Nagula's team and about his book, and the content in it drew me right in. And that's why I wanted to chat with you today and answer some of the questions that are also related to the fertility world, because they affect everything, all of our health, all of our beingness, all of our spirit, everything. So first, can you just give us a quick little bio, like who are you and all the letters after your name and all that, what you do?
Right. So thank you for the introduction. And so my name is Dr. Nagula. I'm actually, by trade, I practice physical medicine and rehab, and then I went on and did a specialized fellowship training in interventional pain management. And so that's what I was trained to do. And for many years, I practiced in this field. I started my own practice about 6 months after I completed my training. It's not something that many people do at the very beginning, because physicians don't typically have any business sense, because we don't have any business education when we're in medical school. So I went ahead and did this anyway, and it was more of an exploration, and it turned out to be very successful. And it grew into a major practice that serviced 2 different states, and also had a surgical center where we were doing high-end interventional procedures on patients. So it was very stressful. And prior to that, obviously, as you know, the life of a physician, we're constantly stressed with what we do, because school is very grueling. And then after schooling for 4 years, you have residency, which can take anywhere from 5 to 6 years, in which you're working, sometimes 80 to 100 hours a week. And it was the culmination of all these things that led me to a position in my practice where I just had enough. And I decided to exit my practice and just take some time off. And it was shortly after, a year later, after I'd taken time off, is when I was diagnosed with stage 4 non-Hodgkin's lymphoma. And so that was pretty much a turning point in my life. And as a result of that diagnosis, I have changed so many things in my life, and I keep changing. And it was in 2014 when I was first diagnosed, and I went into remission in 2015. But as a result, I have changed my life dramatically. And as you know, and pointed out, I've written a book. It's called From Doctor to Patient, and it kind of highlights and outlines my journey, if you will, before having the diagnosis of cancer. Kind of give you an outline of why I got the cancer, and how I went through the treatment processes, and then what I've been doing since.
Yeah, and that's what I meant by it really drew me in. And you give very clear, practical steps that folks can take, and like blasts of education, like this is how this works. And you are a practitioner of functional medicine, right? So there's a lot of good info around that. You also said that you believe not only just the grueling nature of becoming a physician and practicing, but even before that, in childhood. So even, high anxiety and things in childhood affected this cancer diagnosis. Is that correct?
I think we can take it even back a little further. I think it was actually trauma that I experienced in utero, to be honest with you.
Yeah.
And just, well, the issue is that my mom and my dad came from India to this country. And while I was, I don't know, I would think I was 6 months in my mother's womb, and my parents decided to come over here and emigrate. And it was during that time frame where I had, my mom actually lost some weight during the pregnancy. She was 19 when she essentially was carrying me. And when they came to this country, they had no family, they had 0 friends. It was just the 2 of them. And my dad was, he was basically in residency training. And so my mom was just basically alone with me after I was born. And as a result, I think it traumatized her, and that trauma that she experienced was passed on to me. I felt it in the womb, and I essentially had experiences where the trauma was, unfortunately, it carried me forward through my entire life. I think I was born in fight or flight, and that fight or flight was something that I did not know how to get out of. I wasn't trained. So as I was growing up as a kid and as I was an adult, it was me being in a constant state of fight or flight. And it wasn't until, I would say, a few years ago when I learned how to get out of fight or flight, when it really dawned on me that, wow, this was the reason, probably the most compelling reason, combined with a bunch of other different things, that led me to the diagnosis of cancer.
Yeah, I think that it's really powerful when you take it all the way back there. And
Yeah.
what the message that I hear too, that I hear you saying, that, you know, I can sort of culminate it into this one thing, that none of this is your fault, and it's your responsibility to begin changing some things. And the things that you talk about, how to change what's happening, these unhealthy areas of your life, that's what I love to focus on. Now, obviously, okay, so everything that you said, I'm just like kind of excited, because everything that you said there is awesome. And we can talk probably for days around in utero experiences and that early of childhood trauma. And unfortunately, we can't. We don't have enough time. But I'm wondering about this, you know, it's sort of this, it culminated into this huge health crisis, which is a life crisis. And because you're not in the fertility world, I'll say that there's a ton of research. My own doctoral research was around fertility and mindfulness, and post-traumatic growth. But what I found in all the research was that infertility, a diagnosis of infertility, and everything that is related to it has been illustrated as tantamount, really, to a cancer diagnosis. So it's not life-threatening, but everything that one experiences with a fertility issue is very similar. The research says. Now, I haven't been diagnosed with cancer, but that's what the research says. So
I didn't know that. Wow.
Yeah. So this is why, a big reason why I wanted to chat with you, because all of the things that you talk about, how to handle this life crisis, this medical crisis of cancer, is very, very similar to what the research shows about fertility related issues. So can we just get into that? And now again, we can talk forever about everything in your book, but I would love to focus specifically on the energetic changes and spiritual changes that you made just today. And I would love to maybe have you back to talk about other stuff too, but I have a big focus on spiritual and energetic practices within the fertility world. So I'm wondering about that specifically. And if we can start with, so you mentioned something about having more authentic well-being. And I'm wondering if you can expand on that, and what does that mean?
Oh, I think for me, it means more of having more of a purpose and knowing what your purpose is in life.
Yeah.
And I was really, after my diagnosis, I kind of had to sit back and figure out what my purpose in life was. And it was amongst several other revelations that led me to believe that there was more to it than just like having power and making money. That was actually not what through experiences, psychedelic experiences specifically, is what I actually have been experiencing, where I would actually have these revelations and these insights where we're on this earth meant to do something else other than just making money and being selfish and trying to fulfilling our own desires. And it's really all about connection. And I was in a state of depression for a long time after my diagnosis of cancer, and after I got into a divorce and moved back into DC. And after a few years, being alone and being isolated became the new normal for me. And as I was experiencing psychedelics, it really made me realize that that I was kind of lonely. And the problem is that loneliness is a more risk factor for mortality, as having a pack of cigarettes a day, or drinking alcohol, or even having a sedentary lifestyle, or being obese. It is that great of a risk factor.
Folks in the world know that. Yep.
Yeah. And when I researched that, it dawned on me that I could eat really healthy. And I'm sure you have many people on your podcast, you talk about how important it is to eat healthy. But really, for me, it was the biggest thing, aside from taking care of my body, was that I was really lonely, and I needed to have connection. And I needed to, and that was a big part of my revelation when I was researching things for my book. Now, what dawned on me when I was doing psychedelic medicines is that we're all connected. We're all brothers and sisters. We're all united as one, and we need to be we need to connect on a human level, and as well as a spiritual level. And that was what was lacking in my life, was connection, and understanding that we're all connected. We're one with the universe. We're one with each other, which is a psychedelic insight. It all came together to me, and it made me realize that it's really important to have bonds with people. And that got me over. And then as I was getting comfortable in this move to the DC area, I started researching different social groups. That's when I decided that I needed to be around people and not be isolated by myself. And that really is what got me out of my funk, to be honest with you, is to have connection with people and be around other human beings instead of isolated in my own home.
Yeah, I love what you said too about being all brothers and sisters, like all one. We're all connected. And so when one feels so isolated and alone, it's a huge disconnect. And I don't know how it is in the world of cancer, but in the world of fertility stuff, it is such a shaming experience that people tend to self-isolate. So they'll pull back and not connect with other people. And so that fosters that sense of, I'm alone, I don't have, a partner with me. And of course, if one is in a partnership, it tends to suffer too, so that there's isolation there too. Some folks don't have that, they grow closer together, but others, it's a big strain. So I love that you mentioned this. Can we talk about the psychedelic stuff a little bit? Of course, I've done a lot of research on that, but I don't know that I know as much as you. So I'd love to hear about psychedelic medicine and your take and your experience. And
yeah, so I describe it in my book, my first experience, and I'm happy to share that again. But I didn't know what I was getting into when I first got into an underground society that was holding an experience of psychedelic medicines.
Mm-hmm.
And I didn't research it at all. And this was a state of mind where I was very isolated. I didn't want to be around people. I'd canceled on this person 2 other times. And finally, the third time that I actually got invited, I decided to go simply because I felt obligated, because I'd canceled and I felt guilty. And so I still didn't do any research around it. But when I went into it, I didn't know what to expect. And it was very ceremonial. It was very spiritual in nature. And the insights that I got, that wasn't really much that day. It was after over several days and weeks. And I described this in the book, is that as I was driving home from my experience, I was, for the very first time, driving down the street that I'd been on 100 times. I looked around and I noticed things that I'd never seen before. And I noticed the colors of the building. I noticed the paint on the street. I was noticing the leaves on the trees that I didn't ever see before. And I had literally gone over this street 1,000 times. And it's because I was not in my head so much. And there's this thing that's called, it's located in our brain. It's called the default mode network. It's an area in our brain is where our ego lies. And it's basically where the rumination occurs. And the rumination is very constant, and it's often found in people who are lonely and depressed. And it's this stuff that was actually turned off and reset by the usage of the psychedelic medicine. Specifically, what I used was psilocybin. And psilocybin has been a great medicine in the terms of the research that's been around it. And it's been shown that it can actually turn off reset the default mode network. So it allows your brain to actually like pause and not constantly ruminate and appreciate being in the moment. And that was something that I had never experienced before. And it was this quieting of my brain that was so remarkable. And it gave me this sense of peace. And this ego was turned off, and there wasn't this constant like bad talk about myself. It was like this inner voice was turned off, because normally the voice is telling me, you know, it's basically putting me down, and it's just telling me how stupid I am, and I should have done something better. And that's typically the inner voice that I have in my head. I beat myself all over the time, all over.
Oh yeah, you're like most people.
And then that's the thing. Most of us have that inner voice that's awful. And when I experienced this for the first time, where that voice was quieted, it was absolutely wonderful. And it was a product of the medicine, and it was a product of learning to be in the moment. And then this medicine, the psilocybin, which is magic mushrooms, as you may know, it does something that's called neuroplasticity, where it increases the pathways and connections into our brain, so that parts of the brain that aren't connected with other parts will eventually have some sort of a connection. So we're tapping into parts of a brain that's never been explored before. So we might actually have like more creative thinking, more insights, more quieting of the mind. So these are all something that's all beneficial of the usage of psilocybin. Other things that actually occurred for me was that I was a binge drinker, and I would pretty much do a lot of things binging. And that was just the way my life was. And I no longer had the capacity or the urge to even want to drink alcohol like that anymore. Any other compulsive things that I was doing, I would, go out and gamble at, not where I would lose a lot of money, but it's one of my pastimes. So I didn't want to do that anymore. And it's that compulsivity and that obsessive compulsive disorder, or that binge mentality, that was gone, and that still hasn't come back. And I've had a lot of psychedelic experiences since then. So it's the culmination of all of these the medicines that I've put into my body that's had these positive changes on me. I no longer wake up in the morning not wanting to get out of bed. I have purpose now, and the purpose has changed. Like I said earlier on, that my purpose used to be about how much money I could make or how much power I can attain. I no longer have that sense of purpose. It's the wrong purpose. My purpose now is to really educate people, to be of service to others, and to help humanity. And that's kind of what I've been doing since I've written the book, and I've been doing these podcasts and try to educate people on spirituality and health and wellness. So that's kind of been my experience with spirituality and psychedelics. People may ask, well, how much is enough? I mean, everyone's different. I have a lot of trauma that I still have to unravel. And with each psychedelic experience, there's a potential of trauma coming up, and then it's coming to the surface to be released. Trauma is often stored in our bodies, and I've had trauma since when I was in utero. So there's years and years and years of trauma that I still have to unravel. And as I'm unraveling it, and as I have more insights, I gain more knowledge and gain more wisdom of the positive ways to act in the world and be more humane. And so that's why I continue to do it, and because it helps me.
Yeah. Do you find too, this is just popping in my head because of the current, events in America. Do you find that because of these new, synaptic connections, this neuroplasticity, are you finding that you're now better able to handle hard things that come your way now, because they don't stop, right? We all have hard things like COVID-19 and, George Floyd and all these really hard things that are happening in our world right now, but they don't stop. Do you find that it's easier now, even considering the past trauma, do you find that it's easier to move through that difficulty?
I think it is, because you don't get swept away with the sensationalism of it all, even though there is, I'm not trying to say that it's not real and doesn't have merit. It certainly does. All these things have merit, and I'm glad it's being expressed the way it is. But I don't sit there and dwell on it as much, you know, because I'm doing my part. And I feel that there should be justice in what's going on. But I feel personally, I'm not as impacted where it's keeping me down. It makes me want to do something to help society and to help the cause. Yeah. And that's what's going on with the protests. But if we go back to the virus, you know, that's still ongoing. Yep. And it's interesting. I have a different philosophy, and this is all stems from my diving into the spiritual world. I mean, I've come to the understanding that we're all energy, and all energy, it vibrates at a specific frequency, and there are certain thoughts and actions that cause us to vibrate at a lower frequency. Virus like the COVID is basically falls at a very low frequency, and so if we raise our vibration or our frequency above the virus, we're essentially not going to be privy to the virus, and we're able to not get, we might get exposed, but it's not going to tear us up. And that's my philosophy. By being in a state of happiness and love and being of service to others, those are all actions that really raise our frequency and raises our vibrational energy. And as long as we have that and we continue to do that, I feel that the virus is not going to affect us.
See, this is why I wanted to have you on this podcast, because that's my language. That's everything that I talk about. Energy and how we need to increase our vibration, not to ignore or, you know, sort of put aside or eschew what's happening, but to be able to look at it as if from above and say, okay, now what's the action that I need to take? What's the next right thing? Rather than getting really, really marred down by it and angry and violent, right? Which is what a lot of folks have unfortunately done. I'm hopeful that that's changing.
And that's the thing, the anger and the violence, that's a very low frequency and a low vibrational energy. And that's not what we want to succumb to.
Right.
And if we are able to raise ourselves higher than that and really achieve a lot of love, then we can really come across and bond with others and understand what others are going through from a sense of love and not from a sense of jealousy or from a sense of anger.
Right. Right. And just to circle all the way back to authenticity, it sounds like that's what you mean by authenticity, sort of removing this ego person. I am an individual separate from you, separate from you, separate from you, separate from you. That the authenticity was we're all one. And when I do something mean to myself, I'm doing something mean to you. And when I'm doing something mean to you, it means I'm doing something mean to me, you know? So authenticity, remembering who you really are. I love it.
Absolutely. Yeah.
Now, how does that get related? Now, we all have our different expressions of low vibration, right? For you, it was stage 4 non-Hodgkin's lymphoma, right? Was that accurate? Okay.
Yes, yes.
Okay. And for me, fertility issues, for other people, fertility issues, for other people, still all these other diagnoses, diabetes, things like that. So this is why, another reason why I wanted to chat with you, because it doesn't matter the diagnosis. What matters is the energy behind it, right? And then of course our DNA and things kind of are the roadmap for some of those things. But I'm wondering about this combination for you, as you're an osteopathic physician. Is that
correct?
Right? Okay. So as an osteopathic physician, you used this combination of traditional Western medicine and functional medicine, some Eastern stuff, right? Actually, is functional medicine, is that Eastern, or I'm not privy, so I don't know if you can educate us.
Yeah, so functional medicine or integrative medicine is basically espousing and combining conventional medicine with Eastern and alternative medicine.
Okay, and is that where the psychedelics?
That's the difference.
Is that where the psychedelics would come in, or is that?
I'm sorry, could you repeat that again?
Is that where the psychedelics would come in, or is it different?
I mean, it's the same, yeah.
Okay. is the sort of Eastern alternative integrative stuff. I
Yeah.
like to say integrative because it's, yeah. So the other thing, when you were talking about the psychedelic medicine and all the experiences that you had, it reminds me of, I've not taken psychedelics, but it reminds me of when I began meditation and began to see everything, beauty in everything, just beauty in everything. I noticed a bug or something and I'd be like, wow, look at that little creature living its life, just chilling out, finding food, growing, like I noticed smells more. I noticed people more. And exactly what you said about being out of my own head and actually into the experience of the world, it really, really changed. And even hard things became beautiful because they were just learning experiences. So is that basically what you're saying? Is it similar to that?
So you don't necessarily have to have a psychedelic experience to practice mindfulness. I mean, mindfulness is essentially what you're talking about.
Yeah.
And mindfulness is the state of moment to moment awareness where there's no judgment.
Mm-hmm.
And so that's the definition of mindfulness. And there's different practices that embody mindfulness. So you could do things like yoga, meditation, Tai Chi, Qigong. My favorite is breathing exercises or pranayama. And those are my favorite things to do. These are practices that you can employ on a daily basis or however often, even twice a day, that will allow you to actually get more into the moment and not worry about the past, not worry about the future, as we often do as human beings. And by doing so, it reduces the amount of stress that's on our system, our nervous system. And as a result of practicing more and more, we have a more resilient autonomic nervous system so that we only utilize our fight or flight when appropriate. And when we do engage into a fight or flight, it goes back into a normalcy rather than staying in a lingering high sympathetic state. And so that's why it's important to practice these things, meditation specifically for most people. I like to do breathing exercises specifically because it's easy to do. And I think you get the benefits of it immediately and not, meditation. A lot of people have an aversion to it simply because it takes 15 to 20 minutes and people can't shut their minds off.
That's right.
Versus breathing exercises, you can actually see the benefits within a few minutes of actually practicing a technique.
Yeah, I feel like that's almost, if one wanted to start a meditation practice, that's kind of a way to slow down enough to begin meditation. I went into meditation freaking kicking and screaming, man. I hated it. Like, my brain is everywhere. It sucks. But then I realized that was the meditation, is to notice that my brain was everywhere. Right?
Yeah.
And just accepting it.
And
Which is hard to do when you beat yourself up. When you're used to just beating yourself up, it's hard.
And that's the thing. If you don't know any better, then you're just going to get into that cycle of having these thought patterns come into your mind, and then like actually act on those thought patterns. If you're saying that I really suck at this, that I'm useless, then that's the action that you're going to employ. And in reality is just, that's an inner voice, that's your ego talking. And you don't need to listen to your ego all the time.
Nope. Sometimes it's handy. Sometimes it's not. Especially in trauma moments.
I used to hate the ego, and then I learned that I needed to have a better relationship with it.
Yeah.
And what I learned was that the ego is very protective of us, of ourselves.
Oh, yeah.
And that's why we have an ego, because it gets us out of trouble and it protects us from harmful things. But when I learned about that, it made me realize that I needed to tell my ego, tell myself, hey, I appreciate you. Thanks for being around to help me out. And by having that relationship with my ego, it made me feel like we were working together instead of working against each other.
Perfect. Yes. My language. And even I talk about that with people with the trauma response. Like, your brain's doing what it is supposed to do. It's trying to keep you safe. So instead of being like, shut up, I can't, be, hi, thank you for trying to keep me safe. I don't need you right now. Can you hang out over there?
Yeah.
I'm cool. I'm fine. And I love what you said too. The more and more that you do that, it grows these new synaptic connections, these new neural pathways that you won't have to do that as much.
Right.
Just like, the trauma formed in the first place, right?
Or if you want to go on the deep end, you can always explore psychedelics. But I'd always advise to go in a safe way, and it's important to find the right person and the right setting, as that
I
really.
think you advise folks, or you work with folks on psychedelic medicine.
Yeah, I work with a lot of different people, and I know a lot of players in the area, and it's really important to make sure that it's done in a safe manner, because
Sure.
you're exploring different parts of the psyche that can be extremely traumatic, and you don't want to re-traumatize the person. So you want to make sure you're working with an individual that knows what they're doing, that's been doing this for a while, and has some medical training. And it's just, and then the setting, you have to, like I talk about this in the book, and if you read anything about psychedelics, the setting is very important. If you go into an environment where you don't feel safe, that's going to influence your experience. You really want to be around people that you trust. You really want to know the person that's facilitating the experience, and you want to have a sense of safety and feel like you can let go and not have unencumbered thoughts of work or encumbered thoughts of family issues. You really want to go in open-minded without any unencumbered thoughts.
Yeah. I've actually worked with folks on the mental health side who have experienced mushrooms and not at all felt safe, and that absolutely affected their experience to the point that they were like, even completely no chemicals in their system at all, they were still experiencing a deep fear from that experience.
It's happened to me too. And
yeah.
I had an experience where I went into it and I wasn't feeling safe, and it was not a good experience. It was a very bad ceremony, and the journey was not very good. And it was early on when I was experiencing all this, and it deterred me from wanting to do more. But I kept at it because I knew the research and I read it so much about it. But even in the back of my mind, that experience is still there because it was so traumatizing. And it definitely influences experiences that I have until I break that trauma pattern.
Yeah. Thank you for sharing that. I appreciate that. And obviously, there's always the highlighting of safety. So finding somebody who knows what they're doing. And obviously, people can connect with you via here. All of your information will be on the show notes, so people can connect with you that way. That reminds me of something that you mentioned earlier about your main goal being this, I want to be a trillionaire, or I don't know, but you find that abundance now just comes to you because you're not focused on that. Yeah.
It's about positivity, and that's part of the spiritual path that I'm on now, and that's some of the stuff that I've learned through psychedelics. And it was a mentor, a facilitator, who basically told me on my first experience. It was a private session that I had, and I talked with her, and I said, I always have these bad thoughts, and she heard it, but then there was an instance where I actually said something out loud, and I was actually just replaying what was going on in my mind, but I had said it, I verbalized it to her while I was in the journey space. And she basically said to me that exactly what we talked about, is that we're all connected. And if you have a negative thought about yourself, you're negatively influencing someone else's experience in life. And that's why it's important to be positive, and then you'll bring positivity towards you. And as soon as I understood that, and I started to diminish and reduce the negative thoughts and have more positive thoughts and send that kind of emotions out in the universe, it would return to me. And some people might think it's woo woo or whatnot, but it's kind of, it's how it experienced for me, and I've experienced the negative side for 40 some years. And as soon as I turned my thinking around to be more positive, I've definitely felt more positive energy and more abundance come my way.
Yeah. Well, and this is why I love speaking with a physician about woo-woo stuff, because you can actually see from science and from spiritual point of view how this is so effective. And I reference woo-woo in my podcast a lot too, and the connection between science and spirituality. And it's not as, woo-woo as one might think. There's a lot of science behind it. And gosh, you could even just try it yourself. I ask people, just do an experiment. Just do an experiment, see what happens, and I give them practical things to do and be open to receiving whatever back. I'm putting out there, I'm going to see white butterflies. I don't know. And then see what happens. A white butterfly shows up in real life or on TV or on a picture or something. And it's like, whoa, okay, that happened. Yeah. So I'll take woo-woo. Be as woo-woo as you want.
Yeah. Well, I mean, for those who want some science, I mean, there was an article that I just remember reading about positivity and negativity. And there was an exercise where you had to record your positive thoughts and as a journal, you're journaling and you're entering positive thoughts. And as the experience completed itself, the person who actually reported and journaled positive thoughts felt more positive and had a positive disposition after the journaling session. You compare that to a person who wrote negative stuff and had negative thoughts as their journaling exercise. And as a result, at the end of the exercise, that specific person was in a negative mindset and in a depressed mindset, and it was just an opposite of the person who was positive. And that's the power of our thoughts.
Yeah. And then that person, whichever one, goes around the rest of their day either seeing
influencing other people. Yeah.
Influencing other people, also seeing either shitty things or really great things, depending on where their mindset is, right? It's like so interesting. So for not to keep people in suspense anymore, but you have healed yourself, right?
Well, I can't say that. I'm always in the process of healing, but I've definitely yes, I am healing myself.
Can you talk about that a little bit more? I mean, we've talked about specifics, but it's the culmination of all of your practices that move toward healing.
Yeah. So we've talked about two major things that I've transitioned into more of, and that's really affecting the mind and the spirit. Mm-hmm. And we talked about the spirit with the positivity and opening up myself to a better philosophy and life's purpose. We talked about mindfulness, which I do practice now. But the biggest thing that I practice, and I've done this practice since the very beginning, is really how I treat my body. And what I do is very important. I mean, I try my best to eat as healthy as I can. And when I mean healthy, it's not about, counting calories. It's more about what I put into my body. I want to make sure that I'm eating an organic diet. I don't want any traditional foods that have a plethora of pesticides and herbicides, specifically glyphosate. Glyphosate has been tied to my cancer. There has been a correlation between glyphosate exposure and people who have stage 4 or non-Hodgkin's lymphoma. So I have to really do my best to not eat anything that has glyphosate. And if you're really following that kind of a rule, it limits what you can eat because glyphosate is everywhere. And so it's really important to eat organic foods as those organic foods typically eliminate the exposure and the amounts of glyphosate that's in our foods. On top of that, I really pay attention to supplementation. I'm a big vitamin D person, and I make sure that I have plenty of vitamin D. And I live in the DC area, so our exposure to sunlight is poor in the winter months. And so as a result, I have to take supplementation. But I make sure that my levels are therapeutic, and I get them checked twice a year. And you want to make sure your levels are between 60 and 80 nanograms per deciliter. And it has a profound effect on your body in terms of reducing inflammation and also having an effect of boosting your immune system. So those are, and then there's other supplements that I take, but vitamin D is one of the most important things that I think everyone should be on. And if you can't take the supplement, then try as much as you can to spend some time in the sunshine.
Oh my gosh, I didn't realize it was so important. I
Yeah.
always take vitamin D because, so I grew up in Southern California, but I lived in New Jersey for 15 years. And that's when I realized, oh, there's a problem in the winter. Why do I
Yeah.
feel so lethargic? Not necessarily sad, but no energy at all. And then I started supplementing with vitamin D and I was myself again. And now I'm in Oregon, which is also rainy and cloudy in the winter,
Yeah.
especially. But um, I didn't realize it's anti-inflammatory, immune system. I didn't know any of that. So,
Yeah, well, I mean, to take things into perspective, it's applicable to what we're facing now with the COVID. And there have been actually studies and data that purport the usage of vitamin D and its protective effect on our bodies against the virus. There's studies show that it was some study that pulled data from, I don't know, 400 or 500 patients, and the patients who ended up dying or having severe cases of COVID were the people who had a vitamin D deficiency.
oh my
And
God.
the people who actually had the virus and actually got over it quickly or got over it without any negative sequelae were people who had positive and therapeutic levels of vitamin D.
Oh, wow. Oh
Hmm.
my goodness. That is a profound piece of research right there that I hadn't
Yep.
heard about. Thanks for sharing
Yeah.
that.
You're
Wow.
welcome.
Yeah, I think that maybe that's one of the things. I was going to ask you top 3 things that folks can do right now to start taking better care of their mind, body, spirit. Maybe that's one.
Yeah.
Vitamin D.
Yeah, I mean, and right now it's summertime, so it's easy to, if you're in the temperate states, you can get a plenty of sunshine, and obviously, if the darker the skin that you have, the poorer capabilities that your body has of converting the vitamin D from the sunlight into active vitamin D in your body. So that's when you need supplementation.
Okay. Can you say, I suppose everybody's different and a blood test would be able to tell where folks' levels are. Do you recommend that first before going to
Yeah,
get,
I
okay.
would recommend that first. I mean, you could safely start on 2,000 to 2,500 IUs, which is the units of vitamin D as supplementation. But it would be definitely best to ask your physician to get some blood work done to see what your levels are. If your levels are less than 20 or between 20 and 30, you really need to start supplementation or getting out in the sun. You want to shoot for greater than 40, but ideally between 60 and 80.
Okay, cool. So are there other things that you feel like so imagine yourself 2014, you said was your diagnosis?
Yeah, yeah.
Okay, so this is you, 2014. Top 3 to 5 things that you feel like you would have told yourself back then, start doing this
Yeah.
now.
Yeah, I would have definitely, as we talked about, paid more attention to what I was putting in my body, eliminate the processed foods, eating more organic, and eating more of an array, of spectrum of colors of foods. So I always tell people to eat a rainbow color of foods in their diet. Each color has a different phytonutrient that has as a positive anti-inflammatory or in a boosting immune system kind of a effect on our bodies. I would also encourage people to engage in some sort of mindfulness exercise. And that could be anything from doing breathing exercises on a regular basis, meditation, yoga, something where you're shutting off your brain. I didn't mention this before, but binaural beats is another way that I
Oh,
like to also, it's a beats that you can listen to that can actually slow the brain waves down, where it almost puts you into meditative state passively. So I like that. It's a poor man's way of meditation is what I
I
call that.
love binaural beats. That's right.
Yeah.
All of my meditations that I create for people has background of
Yeah, there you
binaural
go.
beats. Yeah.
Yeah. So, and then, and additionally, supplementation, I would definitely encourage people to get their vitamin D levels checked and then supplement as necessary or go out in the sun as often as they can to absorb that sunlight. Um, I'd also recommend people, really the biggest thing, if I was to go back to myself in 2014, is to tell myself is to bond with people more, find connection with people, and get out of that loneliness habit that I was getting so comfortably used to.
Yeah. Beautiful. Perfectly said. I appreciate that. Is there anything else that you would like to add about you, your story, or the folks that are listening or watching right now? I'm sure are already picking up 100,000 things from you, because it's all very useful no matter what, if there's a diagnosis, if there's not a diagnosis, no matter what the diagnosis is. This is all very, very useful stuff just for wellness.
And as you said, that infertility and cancer, I mean, the treatments or the prevention is the same. I mean, right? So, and I did never tie that in together, but now that I've thought about it, and as we've been talking, it makes total sense. You really need to keep your vessel clean, in order to prevent from having cancer and to promote fertility.
Yeah. If I were to sum all this up into just a short little phrase or a couple words, it would be high vibration. Right? High vibration moods, high vibration psyche, high vibration spirit, connection with high vibration people. Because when you talk about connection, you're not talking about people who bring you down.
Oh, 100%. I don't call that connection. No, that's not a connection that you want. It's connection where you feel that. And that's the thing that I didn't make a distinction. If you live in a city and you're around people, you can still be lonely because you don't have that sense of connection. And connection is important because you want to be felt that you're being heard and not. And that's the worst thing is you're speaking to someone and you're not feeling that you're being heard. That's loneliness. That's lack of connection.
Yeah, perfectly said. All right. Well, your ways that people can connect with you, it'll all be on the show notes, but if you can briefly say, where can people find out more about you?
Yeah, you can find more about me on my website from doctortopatient.com, and which is also the name of my book, From Doctor to Patient, Healing Cancer Through Mind, Body, and Spirit. And I also released a podcast series where we talk about health issues that are off the beaten path but have science behind it and have tremendous ways of healing. And that's my podcast series is called From Doctor to Patient. Yes.
So from doctor to patient, all across the board. I was saying before I started listening to your podcast, and it's really great. Folks need to listen to that. And of course I read through your book too. And it's even folks who are struggling with fertility stuff, it's such a great read. Just for if you only go for just the story of what you've been through, and how you transformed yourself, just that alone. But if you happen to know of anybody who's experienced cancer, yeah, it's a great gift too. Pay it forward.
And the things that I talk about in the book are not specifically only applicable to patients who are having cancer or trying to prevent cancer. It is for anybody who is seeking to gain in the health and wellness field. Yes, to transform themselves. Yes. All right. Wonderful. Thank you so much for being willing to be on this podcast today. I appreciate you. You're so welcome. Thank you for having me.